Hello, this is Dr. Neerukonda. One of the biggest questions I get regarding eyelid surgery or blepharoplasty is, am I a candidate? Common reasons to consider an evaluation include feeling the eyelids are droopy, they're affecting your peripheral vision, they're making it difficult to drive or read, you may notice that you feel or look sad or sleepy, or you simply just don't like the puffiness that can be present on the upper and or lower eyelids. It is important to get a formal evaluation as there are many overlapping components that can come into play, and we need to decide whether you're a surgical candidate or a non-surgical candidate or a combination of the two. The surgery itself, whether it be upper eyelid or lower eyelid blepharoplasty, is outpatient surgery. Upper eyelid blepharoplasty includes removal of the excess skin from the upper eyelid and debulking of some of the fat that gives you the puffiness that many people complain about. Lower eyelid blepharoplasty can be considered when the primary concern is the puffiness or the bags of the lower eyelid. Incisions during these procedures are typically naturally hidden in the normal eyelid crease or the natural eyelid crease of the upper eyelid, or oftentimes done on the underside of the eyelid, so there's no incision at all that's visible. Dissolvable sutures are typically used, or they're removed at 1 week. The next question I often get is what to expect after. My advice is as follows. It's recommended that you take it easy for that first week, so I like to emphasize no heavy lifting, no strenuous exercise, no bending over too much. You can do things, just don't overexert yourself is the takeaway message there. I like to also stress that eyelid skin is very thin, so there can be a big spectrum of swelling and bruising that any patient can encounter after surgery. It's not uncommon to have a very black and blue eyelid after eyelid surgery. This tends to be the worst over the first week. It dissipates over the first 2 weeks, and usually by 2 to 4 weeks, the vast majority of the swelling is resolved. We recommend over that first week that you also use a copious amount of ice. I'll prescribe a topical antibiotic ointment that's safe for the eye for you to use over the course of that first week. You will use over-the-counter ibuprofen and Tylenol for pain comfort, and there are no patches used after surgery. And as I mentioned before, the sutures that I generally use are either dissolvable or I plan to remove them at the first week after surgery. Again, we look forward to the privilege of taking care of you here at Longwood Eye and LASIK.